In this video, Kenzie and I are going to show you 3 cervical traction techniques that you can do. So the first version of cervical traction is Kenzie here in supine. She's just lying on her back. So what I'm going to do is just go right underneath her occiput, right below the base of her skull, that suboccipital area right there. And I'm going to pull. You got to be careful where your hands are. Be careful, don't squish the ear, especially that earrings. And what I'm going to do is keep my elbows straight and just lean back and pull. Just a gentle traction. Now, how hard should I pull on this? So some people like to get very aggressive with this and pull very, very hard. What I'm looking for is to see if her feet move. So if her feet and toes move, I know that I'm pulling about the force I like to pull. And of course, that depends on how she feels, how much pain she's in. And it's like to pull just till I see her toes start to move, and then I hold that force. And I may hold this anywhere from 10 seconds, maybe up to a minute, maybe even 2 minutes. Here's the tip with this is, don't sit here with your elbows bent. You're going to wear your biceps out. Try to get your arms out as straight as you can. Extend the elbows. And then I'm just basically using my trunk to lean back and create the force. Is that okay? Mm-hmm. So that's just a traction technique to open up that space. Maybe you have a protruding disc or a herniated disc, or maybe you have stenosis where you have this closed off area. So I'm just trying to open that up. So that's one technique. Another technique, while that she's on her back, I can do is put my forearm in the sway of her neck, that lordotic curve of her neck. So I'm going to put my forearm through here. Then she's just going to lie back. Now, what I'm going to do is try to keep her head as straight as I can, and I'm going to roll my forearm to me. So I'm rolling it to me. And so watch. When I roll, you can see that pull there. So this is an easy technique to do, especially if she's very sensitive. I can just do a gentle roll and just hold that pressure. And then again, I might hold that anywhere from 30 seconds, maybe up to 2 minutes. It just depends. But I'm just rolling my forearm like this to me. So that's an easy technique. And now we're going to show you the technique that you would do if she was on her stomach. Like to do with a person in prone or they're on their stomach. And the thing with this is a great technique if the person can't lie on their back. Maybe they have some low back issues, they can't get on their back. Maybe they're having episodes of vertigo and they're not able to lie on their back. So she's going to go on her stomach here. This is very, very simple. I'm just going to take one hand in her upper thoracic area and I'm pushing down. And with my other hand right at the base of the skull, I'm just going to pull up. So this hand's pushing down, this hand is coming up, and I have a pillow under her chest so I can keep her head in a pretty neutral position. So I can do it that way. The other variation of this is I can come in with both hands right at the base of her skull and pull her to me. Just be careful that you don't choke the person, on the pillow or anything like that. Make sure they can still breathe. You okay right there? Mm-hmm. So a little traction there. And again, I would hold that a few seconds, maybe even up to 2 minutes if I can hold that force, just to try to open that space up. I like this technique and I've used this a lot. And you can incorporate this while you're doing soft tissue work, maybe scraping or massage or whatever, and just come in and do a little traction like that when you're doing everything, so you don't have to like reset. So good technique I like to use. The last version of traction is going to be in seated. So let's say you have a patient that can't lie down either on their back or on their stomach, and they have to stay in the seated position. So there's 2 versions of this that you can do. One is going to be a little bit easier than the other one. I'm going to show you the harder one first. So I'm going to come up just right behind her. I'm grabbing both sides of her head, hooking my thumbs under the base of her skull. Now with this, you have to remember, don't smash the ears, especially if they're wearing earrings. I'm going to come all the way down to the skin, and I'm just going to pull straight up, a little lifting just like that. And I'm doing more lifting with my legs and my trunk, more so than trying to push up with my hands. I kind of get her stabilized here, and then I go up and down with my legs. Now, the easier version of this would be, you take a pillow like this, I come in from the side, I'm just using the pillow. You don't have to use a pillow, but it does help keep the head in a little bit of alignment, and especially just kind of protect some personal space here. So I'm going to come around and cup underneath her chin, just like this. You have to be careful here if the person has TMJ. Are you okay with this right here? Mm-hmm. And I'm just lifting up again. This simple technique. There are several versions of this. I like that one the easiest. Be careful not to choke them. Also be careful not to pull in the jaw if they have TMJ issues in there. You want to be careful and not irritate that. But again, those types of things, that will be harder to hold for up to 2 minutes. You're not going to be able to hold it this long, but just another great version of a technique for cervical traction that you can do. Thanks guys, I hope these techniques help. Make sure you head on my website, chadgeorthoot.com. You're going to find information related to orthopedics, sports medicine, rehabilitation, and links to some awesome products. Thanks so much.